So I am Dr. Appaji Gowda. I am a senior ophthalmologist. I have put in 40 years of experience in ophthalmology as eye surgeon, and I am running Vijay Netralaya at Nagarbavi second stage. Dear friends, normally the cataract develops after 50 years of age. Usually it is called as senile cataract, and so this senile cataract, which appears after 50 or 60 years, it is seen in healthy people who are very healthy, who led a normal healthy life. They develop this cataract and it is called as senile cataract, and we operate and we restore the vision. But what happens if the cataract occurs before 50 years of age? So this is also called as pre-senile cataract. And why this pre-senile cataract is seen in such an early age, say around 40, even 35 years of aged people, they are coming for cataract surgeries. Now what would be the cause, or what are the causes for such early development of the cataract? The most common cause is diabetes. In diabetes, it is the poor nourishment of the lens. Actually, what happens in diabetes, when the blood sugar level goes up, the hydration of the lens increases. And when the hydration increases, and if it continues for some more time, then the lens becomes opaque. So this is the common cause of cataract in diabetes. That is the reason why in diabetes, the blood sugar levels should be controlled. If the blood sugar increases, then the chances of lens becoming opaque are there. And if it is persistent, definitely the lens will become opaque. That is the reason why the raised blood sugar level should be controlled. It should be brought back to normal levels. That is the common cause of diabetes. And nowadays people around 30, 40, and they are developing cataract, and they are developing diabetes also. The other causes of cataract in young patients, that is due to excessive use of steroids. Say for example, many people, they develop severe dry eye and allergic reactions in the eye. They use steroid eye drops and they get relief. And many people, they go on repeating steroid eye drops without any consultation or proper advice from the eye doctors. And if they go on using, they develop cataract. Other patients like asthmatics who are using steroid as inhalers or oral steroids or injectable steroids, they also develop cataract in the early age. Similarly, the construction workers or manual laborers in urban areas, drivers who drive the vehicles during daytime, they are also prone for early formation of the cataract in their eyes. The other causes of cataract in the early age is exposure to the excessive sunlight. Say for example, in farmers, they expose the eyes for hours together and days together under the sun. Then those people, they are prone for early cataract formation. So the excessive exposure to the sunlight, the reason is the UV light damages the lens proteins. That means the lens protein structure is damaged and the lens is prone for cataract formation in the early stage. The other causes like excessive smoking, excessive use of alcohol, tobacco, even these things can cause early cataract formation in young people. Then similarly, any patient who had undergone intraocular surgeries like vitrectomy, glaucoma surgeries, those patients also, they are prone for early cataract formation, or in other words, the cataract formation is almost certain in these patients. The other causes of the cataract in young people is the injuries in the eye. Blunt injuries to the eye or even perforating injuries can cause cataract formation either immediately or after many months or years. These people are prone for cataract formation in the eyes. Rarely, myopia also, particularly high myopia also, can lead to cataract formation in young people. The other causes of cataract formation in young people is due to the poor nourishment. Say for example anemia, then malnutrition. These are the causes of cataract formation in young patients. Anemia, particularly during pregnancy or after pregnancy, an individual becomes anemic. They are also more prone for cataract formation, and any malnutrition, including any deficiency like antioxidants, vitamins, proteins, all these can lead to cataract formation in the early age. The other cause would be exposure of the eyes to the excessive heat. Say for example, professional cooks, they are more prone for cataract formation than people who are getting exposed to the heat. Say for example, these people who are working in furnaces, factories, particularly the iron and steel factories, they are also more prone for early cataract formation. Then in young people, if a person suffers from any intraocular eye disease, say for example uveitis or chorioretinitis, so these are the middle coats of the eye. Uveal tract is the middle coat of the eye. Any inflammation in the middle coat, whether it is acute or chronic inflammations, and particularly if they are on long-standing steroids, they are more prone for early cataract formation. That means in the early age. Can early cataracts be prevented? So it is a very difficult task. Only thing is prevent diabetes. That is the prevention of diabetes or the onset of diabetes itself. Nowadays, lot of discussions are going on about the prevention or reversal of the diabetes. Then wherever possible, the better methods to prevent the early onset of the cataract formation is good control of diabetes or reversal of the diabetes. Then steroids should be used very judiciously. Then avoid long exposure to the sunlight, and if they are exposed, better to use UV glasses. Then avoid smoking, better to avoid alcohol itself. These are the better techniques or better methods to prevent early onset of the cataract.